Hello, my name's Denise King. I work for Bournemouth University as a lecturer in midwifery, and I develop the virtual reality learning environments for our healthcare students. This demo will take you through a short tour of those virtual reality learning environments. These virtual reality learning environments form a suite of digital resources which are part of the educational toolbox available to healthcare students at Bournemouth University. These digital resources complement our traditional theory teaching. They're not intended to replace it, but they offer healthcare students a place to practice both hard and soft clinical skills. They can be used in a variety of ways, including self-managed study, to prep for theory sessions, or as part of the in-class theory sessions, as review sessions to embed the theory, prep for clinical placement, to bridge that gap between theory blocks and clinical practice or blocks, practicing for assessment. And even they've been used during observed structured clinical examinations. Virtual reality learning environments are profession generic and they're topic specific, which maximizes their potential for multidisciplinary use. And they can be experienced asynchronously or synchronously as a way to learn with others from the same or mixed disciplines. Virtual reality learning environments provide opportunities to practice standard everyday sorts of clinical skills, such as testing urine, and also skills that can't otherwise be guaranteed as part of their clinical practice placements, such as emergency situations or safeguarding situations which require skills in having challenging conversations, developing confidence in your individual ability to perform intuitive, holistic healthcare. The technical platform for these virtual reality learning environments was built by Dayton, who are a specialist virtual reality education company. I've put together some clips from the virtual reality learning environments. I do apologize for the quality of it. It's not something that I'm clearly very expert in, but I'll screen share and I'll show you the clips that I have made and try and explain a bit about them as we go along. So this first clip that you're going to see is where the students can practice testing urine. So this is just a segment of it. And what you're looking at here is the container that has the urine sticks. It allows the students to go on, and this is a video that was filmed a few years ago, which is why the sticks appear out of date. They aren't in the actual virtual reality learning environment. The students need to interact with the client. They've got opportunities to practice washing their hands, putting on personal protective equipment, a skill which is quite necessary all the time during clinical care, and particularly so during the pandemic. They can look at the sticks and make sure that they're measuring them the right way on the container, so that when they're reading the results, it is the correct result they're reading. They can practice their documentation, timing of the urinalysis. In this virtual reality learning environment, this is a diabetic patient who is having a hypo. The student has some equipment in the room, and there's various things as well that can be looked at in order to kind of decide what's going on and what the plan of care is next, who needs to be involved or invited in, or whether this can be managed as an individual clinician. So there's various items in the room that the student can use to make decisions. In this scenario here, this person's having a postpartum hemorrhage. As you can see within the scenario, the blood is visibly dripping down the side of the bed. It's very true to life. When someone's bleeding, they can bleed quite quickly. So the student has to answer a series of multiple choice questions and make decisions about how the care should progress based on what they're observing. They can invite fellow clinicians in, and they lead the management of the scenario. They can make requests for equipment or for certain things to happen within the virtual reality learning environment, like oxygen to be administered. The PPH box, which you can see here, has been opened and set out in the trolley. There's IV fluids now going in. The oxygen mask is on. In this one here, this is one of the safeguarding scenarios. As you can see here, there's an open pond. So the student has opportunities to indicate if their gut instinct has been triggered or if there's alarm bells ringing. Some of the things are quite obvious, such as this open pond. Other things within the house, some of them are obvious, some are not so obvious, because these are suitable for students throughout the 3 years of their training. And so we want to give them opportunities to have very positive experiences, even at a very early level within their training. And then this learning and this is scaffolded throughout their 3 years. So I just did a turnaround in the demo just to show you what the housing area looks like. But this is the only house that the students can go in and interact with the clients within this house. The students are invited to go walk up to the door, ring the doorbell. They then need to have some dialogue with the family in order to be invited into the house. Just like in real life, you couldn't just walk in and have a look around without being invited in. However, once the students are in the house, they are given an opportunity to have a look around, which you wouldn't get in real life, because that's part of the fun of learning virtually, isn't it? And you can do things and see what happened and what the reactions are that you wouldn't get an opportunity to do in real life, otherwise known as safe fails. So when the student looks around this house, there's some things that are immediately obvious, like this child sleeping in the dog crate. There's evidence of a party. There's an infant that's sleeping on the couch with an as yet unidentified male. When you get a closer look at the woman, her arm appears quite bruised, etc., and so on. And this is another family from a different social demographic. And in the first family that you saw, there's quite significant safeguarding issues when the student finally gets a chance to examine the baby within that scenario. There's significant bruising to the whites of the eyes, which is often indicative of a brain injury, and so on. But the husband is a respiratory consultant. He's quite reluctant to for the baby to be referred into hospital for further investigation. And I'll just pause that for a second. Quite reluctant for the student to refer the baby into hospital for further investigation. And the student then has to develop skills in negotiation to appeal to this person as a fellow clinician and also as a parent, to understand that it's in the baby's best interest that he accepts that it needs to go in for further assessment. And the student also then has to decide which way does this infant need to be taken into hospital? Is it by emergency ambulance? Can the parents take it in, etc.? So there's many levels of learning, and it's suitable for whatever level the student's learning at, because there's always more learning to be had within it. In this one here, as I said, it's a different social demographic, but again, you need to negotiate to gain entry to the house. It appears as a young boy at home on his own. The house, there's a lot of clutter in this house. He's quite rambunctious and doing things that perhaps he shouldn't be, such as doing roly-polies near an open fire, a heater. Within this house, it's quite noisy. There's a constant noise of wrestling going on in the background, which makes it more difficult to concentrate and make decisions, but is true to life. Some of the houses that we go into are like that in healthcare. As the scenario goes on, his sister comes home. It is the middle of the day. They both try and wake their mother. The mother is difficult to rouse, but she does eventually come down, and the scenario progresses like that. And the students having to make decisions, again, indicating whether there's things that are setting off alarm bells or setting off their gut instinct. They can also make decisions about who they feel this family should be referred to, what sort of help perhaps that this family needs. They have quite in-depth discussions with every member of the family to try and make those decisions and to get them to consent to be referred and to accept that actually some safeguarding interventions are required and that it will be of benefit to them. So that's just a short run through of some of the virtual reality learning environments that we offer to our healthcare students. I hope you found that interesting. I look forward to seeing you on Wednesday, and I'm happy to answer any of your questions that you may have at that time. Thank you for watching this demo. Bye for now.